Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. In the name of Allah, the most gracious, merciful, the creator, the sustainer, and the king of the whole universe. After this, assalamu alaikum wa rahmatullahi wa barakatuh. My name is Sanaullah. Basically, I belong to North Waziristan. And sorry, sir. Stop kar this dobara.
No, it's live. Yes, you can continue.
Sir, live hai?
Yes, this is continue.
So today my presentation is on 7.1 element, in which we will discuss forms of chemical and biological agents. So first of all, what are chemical agents? Any substance which affect our health is called chemical agents. Forms of chemical agents.
Okay.
Forms of chemical agents: dust, silica dust, fumes, welding fumes, mist, acid mist, gas, chlorine, vapor, petrol vapors, liquid, HCl, hydrochloric acid, liquid, hydrochloric acid, solid, lead. So they have effects on our body. Some are short term and some are long term. Short term effects of chemical agents on our body is skin irritation and bones, eye irritation or damage, coughing and breathing difficulty, headache and dizziness, nausea and vomiting, poisoning.
Good.
What are the long-term effects of chemical agents on our body? Chronic means long-term effects on our body. Respiratory disease. Silicosis is a disease which is caused by the dust of silica. What is the source of silica dust? When an individual cutting, grinding or drilling bricks or cement. So the silica dust arises from the grinding, cutting and drilling. So when an individual inhale the silica dust particle goes to our lungs through air passageway. So there in our lungs there are alveoli. What are alveoli? Alveoli are the functional and potential unit of our lungs where gaseous exchange take place.
Good.
So in alveoli there are immune system, white blood cells which are known as macrophages. Macrophages are responsible to engulf and destroy the foreign pathogens which causing agents, which cause disease. So when the silica particles enter over alveoli, the macrophage attacks on the silica, but due to the hazardous or toxic nature of silica, the silica dust or particle kill the macrophage and inflammation caused in our lungs. In this way, our lungs damaged and irreversible. The second one is asthma. Asthma is a difficulty in breathing. When an individual has asthma, air passageway is responsible for transporting oxygen. Asthma in our trachea is responsible for passing oxygen. When our wind pipe trachea accumulates more mucus, so there is difficulty in breathing. So a doctor prescribe inhaler to the patient. When they formed the inhaler, the air passageway dilate for oxygen.
Good.
Lung cancer, liver damage, as liver is responsible for detoxification. When any toxic particle enters to our body, the blood transfer to the liver. Liver is affected for detoxification. Kidney, as in our kidney, nephrons are responsible for filtration.
Good.
When they transfer to kidney, the nephron damage, and nephron is the functional and functional unit of kidney.
Good.
Nervous system disorders. And what are forms of biological agents?
First of all, I will explain you about this silica. What is silica? Like you see in our area, especially in the Jangiri area, there are crushing stone machines which is producing chips over there, chip stone. Similarly, there are marble machines. Similarly, here in the Margala Hills, if you saw, they are doing blasting over there. So when you in the morning you wake up in your home, there is a continuous white dust over present there. So silica is white crystalline dust. What do we mean by crystalline? It will, when you check it in the microscope, the silica dust will be like a crystal. The asbestos we have just before in the slide, asbestos in needle form in the air, and these are micro dust, means it cannot be visible to your naked eye. Like if this here is here in our training room, and you see all the areas very very clean over here. But Mr. Suleiman, just see in front of this projector. Can you see the dust particle over there in the beam of light? Yes. Which is not visible to the naked eye. Similarly, these particles will be present in the workplace where silica is there. Now, the dust particle in the concentration will be in two levels. Okay, one is called inhalable dust and the other one is called respirable dust. Now, inhalable dust, Allah gave us a protective system in our human body. There are two kind of protective system in our human body. One is internal defense system and the other one is external defense system. In our internal defense system, we have a system of filtration in our nose. You see our nose is filled with the particles in the night. What is it? Our human body, our lungs are continuously filtering the air, and it goes inside from the nose to the throat and then goes to inside to the lungs, and the oxygen is trapped in the immune system by the taking by the lungs, giving it to heart, which is called oxygenated blood. Mostly people say, what they say, they eat ganda khoon. No blood like this. The oxygenated and the deoxygenated blood. So this is the process of our circulatory and respiratory system. The other one system is in our mucus over here. These are also internal defense system. And in the external defense system, there is a system on our skin. You know, this skin is also protect you. If the skin is okay, it will protect you from what? From different kind of particles going inside to your body. Like I mostly give example to the student, what we do mostly in the burn case. Like you have a hot water and it continuously burned out your hand. What is our immediate step mostly? What we are doing? Mr. Nadeem, what we do in case of burns of our skin? What we do? We mostly put some ointment like Bernal over there, sometime toothpaste over there. Okay. Now keep in mind, if it is the first degree burn, so is it okay? But if it is the second or third degree burn, it damage your skills and also inside the protective layers, the skin layers. So when you put this chemical or anything burning for the burning like Bernal, or you put it any other thing, the layer of protection is now very exposed to the bacteria. So the first harm that the bacteria will go inside to the body due to the poor skin condition. And the other damage what will cause, when you go to the doctor, they will remove it to see what kind of condition inside of the layer of your body. So a complete damage will be happened. So people don't know about it, how important are your skin condition is. If the condition of your skin is okay, in a good condition, you will not expose to the bacteria, especially the viruses, because chemical enter into our body by four means. But first of all, I will explain to the respirable dust. The inhalable dust may be stopped by this system of filtration. But when the dust particle become very, very low, microparticle, less than 7 microns, then it called the what? Respirable dust. Now it will go inside to your lungs because it cannot be visible to the naked eye. So in the ear you will say it is clean, but if the respirable dust is there and it goes inside, so what explained by Mr. Saifullah, I think, Sanawallah, that it will cause damage to your lungs, like cancer, asthma. What is the condition of asthma? Now your lung is not absorbing the oxygen level. You saw some people, especially those people who is continuously smoking. At the end, in the old age, they become asthma affected. Okay, TB, tuberculosis. This is also a very serious condition due to the particles, serious cases in Pakistan over here. And sometime it completely damage your lungs. So I hope so now you know about the respirable dust and inhalable dust. So you have to protect your worker from the both dust, from the respirable dust and from the inhalable dust. And the best is prevention, okay? Not like this that you will give the mask to them that you use it so your lungs will be safe. Like you explained, Mr. Nadeem, LEV system, local exhaust ventilation system. So you have to install a local exhaust ventilation system or normal good ventilation of air. Now again there are dilution of air. I will explain you this because now in the last slide it is not explained. Dilution of air. Two kind of dilution. Active dilution, passive dilution. Like in a room, the air is very much hazardous. What you have to do? You can open the doors, okay, you can open the windows and the cross circulation of air will be happened over there. But it will take time and may not be possible deep inside the confined space. Because if you open the confined space and it is very deep, the air will not go inside and come outside. So for that you have to use an active system, active dilution, active system, which is like exhaust, extractor fans, etc. Adductors sometimes we utilize in the tanks or in the confined spaces. So this is required. Now the last topic I will explain, then we come to Mr. Sanawallah, that 4 routes into your body. When a chemical vapor is or any substance vapor is there, it goes inside your body by 4 routes. First one is inhalation, because our human body required inhalation. So if air is there, we have to inhale. So if a dust particle is over there, it can goes inside to our lung due to inhalation system, breathing system. The other one is called injection. What is injection? Like needle stick. The contaminated needle of a one person, like nowadays in Pakistan, as I told you, HIV, AIDS, so many cases are happening over here. So if a person with HIV blood and it is on the needle and that needle is injected into your body, so the virus of HIV will be converted to you. Anyone. Then the third one is absorption. What do we mean absorption? Like you have cut here in your skin and you are putting your hand on a chemical or any substances where bacteria or virus is there, it will go inside to your body. Through the what? Through the absorption. And there is another absorption point in our body. Eyes. If a blood of a person which is contaminated due to the virus or bacteria and that blood drop goes inside to your eyes, so the chemical bacteria or virus will be converted to you. And the fourth one is called ingestion. What do we mean by ingestion? The liquid, anything chemical or anything which you take it to the mouth and goes inside to your lungs, that is called goes inside to your stomach, that is called what? Ingestion. So there are food. If in an interview someone asks you what are the 4 ways that chemical goes inside to your body, you will say 4. What are those? Inhalation, please. Next, injection, absorption and ingestion. And the most serious one is which one? Inhalation. Very good. Because we have to inhale. We can protect ourselves from injection, absorption, okay, ingestion, but we cannot protect ourselves from the inhalation. We have to inhale over there. So the most important thing is that you will keep in your mind that you have to focus on the inhalation system. And you just explain OEL. You know what is the disadvantages of OEL? OEL is only concerned with the inhalation system. OEL is only for the inhalation, for the breathing system. OEL is not dealing with the other 3. So this is the limitation of the OEL. I hope so sometime if an interviewer asks you what is the limitation of OEL. So this is also a very important point which I explained to you. So now you know about this, what I explained. I hope so now it is clear to you. Please continue.
So the second one is biological agents. What are biological agents? Any substance or organisms which affect our health, such as bacteria, viruses, fungi, parasites. Bacteria, tuberculosis, TB, viruses,
which I explained you.
Yes.
TB bacteria.
HIV, human immunodeficiency virus,
Good.
ringworm, malaria. Short-term biological agents effects. Infections. It causes infections. Fever. What is fever? When the body temperature increase from the standard. Coughing and breathing problem.
Like normal temperature we yesterday explained is 98.6 degree Fahrenheit. So if a temperature arises, there may be a reason for it. So when a bacterial infection occurred in the body, bacteria into body, and it kill your good bacteria inside the body, so the fever started. Your body temperature raises. It means there is a problem in your body. Now you need to check it because it will not easily cover.
Allergic reactions, food poisoning, diarrhea and vomiting. Long-term biological agents effects. Chronic infection. Chronic means for long-term infections. Tuberculosis, hepatitis B and hepatitis C, asthma due to biological allergens, organ damage, weakened immune system, cancer from certain biological agents, death in severe cases.
Yesterday one of our close friend died. But you know why? Because of the hepatitis B. Because hepatitis B, when you came to know hepatitis B, so it will completely damage your liver. And it is chronic, it may not be reversed. So for hepatitis B, there is no cure. What you have to do, vaccination for 5 years. And first check your blood, okay? Do hepatitis B and C HIV test because you will be required for the medical also when you are going to abroad. So check it, if your body blood is okay, then preventive measure, take vaccination for hepatitis B. For you, for your home people also. Nowadays it is very, very serious. Hepatitis B and C are the silent killer in Pakistan. When you came to know, it completely damaged your lungs, your liver, and it will not be maybe replaceable. Please.
Route of entry for chemical and biological agents.
Very good.
Number first one is chemical agents.
Yes.
Inhalation, breathing in dust, fumes, vapors, mist or gases.
Good.
Number two, injection, swallowing contaminated food, water or hands.
Good.
Number three, skin absorption, through intake skin by contact with chemical or other solutions. Number four, eye contact, splash or contact of chemical with eyes.
Good.
Number five, injections, entry through punctures or cuts, for example, contaminated needles.
Good.
Number second, biological agents, inhalation, breathing in airborne microorganism, droplets, aerosols, dust. Number second, ingestion, swallowing contaminated food, water or hands. Number third, skin contact, entry through cuts, abrasions or broken skin. Number four, mucous membrane contact, contact with eyes, nose or mouth, mucous membranes.
Good.
Number five, injections through needle stick, bites or other punctures. Number six, vector borne, entry through bites of infected vectors, for example, mosquito ticks. For example, malaria is caused by a parasite which is known as Plasmodium. What is Plasmodium? In ancient time or in the initial time when malaria was spread all over the world, so the people were thinking that the malaria is caused by bad area. Mal means bad, area means area, bad area. But when scientists start researching, they come to end that malaria is caused by a parasite which is known as Plasmodium. And Plasmodium is when Plasmodium transferred by a special mosquito which is known as Anaphylaxis mosquito.
Good.
What precautions are needed for this? Biological agents, personal hygiene, wash your hands properly,
Okay.
PPP, gloves, mask, vaccination and sterilization, safe waste disposable.
Sterilization, you know, like in the dental clinic, they have equipment which sterilize the equipment all.
Yes, sir.
Okay.
Isolation, contaminant, vector controls, chemical agents, proper ventilation, PPP, gloves, mask, goggle protection, clothing, follows SOPs. What is SOPs? Standard operation procedures. Safe storage and labeling, good housekeeping, spell control, measures, training, and awareness. Thank you so much for listening me attentively.
So, very good presentation by Sanawala, which he explained you all the things. I hope so. Now you have the knowledge of it. Of different kind of chemical, we also explained it. Next is Mr. Zain.
Bismillahirrahmanirrahim. My name is Zain Ayaz and today our topic is fire. So what is fire? Well, first we learn objective. Describe principle of fire, describe classification and spread, describe zone and causes. Firstly, we discuss fire. In simple definition of fire, the burning of material that release heat and light is called fire. In other way, the technical term, the rapid chemical reaction between the oxygen and the combustible material.
Very good.
Another very important slide, fire triangle. If you go for interview for safety job, interviewer must ask them make a diagram of fire triangle and label it.
Good. What are the component of this triangle?
Component oxygen, fuel, heat, three component.
When three components combine together, it causes fire. Okay. But for interview, as you said, okay, I will tell you that now this fire triangle is in a latest form. That is called fire tetrahedron. What is it called?
Fire tetrahedron.
So the fourth component, tetra means four, tri means three component. So what is the fourth component? When this happened, the oxygen, fuel and heat combined, it started a process which is called combustion. Like he explained, combustible material. Okay, oxygen, the rapid chemical, the combustion process. In combustion, it produces again three things. One is smoke. Like a fire happened, you remember the stadium for football fire. So when the fire has happened, you will see a lot of smoke over there, black smoke over there. Is it okay? Yes. The other one is flame. You will see when the fire is occurred over there, you will see a flame over there in the fire. And the third one is heat. You will feel the heat due to the fire. So this is the combustion process. So the chemical reaction is the fourth component now. All three things combined and a chemical or chain reaction started. This is the fourth component. So why is it called what? Fire tetrahedron. Noted with yourself because interview will ask you. You will explain the fire triangle and he will ask you what is fire tetrahedron. So what you have to say in fire tetrahedron? Four components. First one is oxygen, heat and fuel. And the fourth one is
Chemical.
the chemical or chain reaction. And to extinguish the fire, what you have to do? To cut this chain. Any one of these. Like you remove oxygen, the fire will be extinguished. You remove fuel, the fire will be extinguished. You remove heat, the fire will be extinguished. Is it okay now? But there are names. Again interviewer will ask you. What do we mean by removal of oxygen, removal of fuel? What do we call it, the removal of heat? So again write down yourself. To remove heat from fire is called cooling. To remove heat from fire is called cooling. To remove fuel from fire is called starvation. And to remove oxygen from fire is called smothering. To remove heat from fire is called cooling. To remove fuel from fire is called starvation. And to remove oxygen from fire is called smothering. Like a fire is there, a candle is there, and you put a glass on it. Without any air, it will be extinguished after some time. Why it is extinguished? Because you cut the oxygen. So if you cut oxygen from a fire and someone asks you what it is called, you will say it is smothering. Okay, a fuel is there, like LPG gas is over there, and you close the wall, so the fire is automatically extinguished. So what is it called? Starvation. Starvation का मतलब होता है भूखा करना आपको. सही हो गया. जब आपने लकड़ी से आग जलाई हुई है तो देखते नहीं है, जब आप उससे लकड़ी निकालते हैं देख बनाते वक्त तो आग बुझ जाती है. तो क्यों बुझ जाती है? क्या आपने उससे क्या हटा दिया है? आपने उससे फ्यूल हटा दिया है. समझ आ गई इस बात की. इसी तरीके से जब आप उससे हीट को हटाओगे, अब हीट कैसे कटता है इसकी आसान मिसाल ले लें. आपने एक चीज़ पे आग लगाई हुई है और उसके ऊपर जैसे पानी डाल दो, वो बिल्कुल कंप्लीटली कूल हो जाता है, तो उसको क्या बोलते हैं? कूलिंग मेथड. तो आपको ये याद रहेंगे. अब मैंने कुछ टर्मिनोलॉजीज आपको इसलिए एक्सप्लेन की है कि मिस्टर जैन ने बोला कि इंटरव्यूअर, तो इंटरव्यूअर हमेशा आपसे पूछता है ये जो चीज़ें मैंने आपको बताई है, ठीक है ना. अच्छा, अक्सर औकात एक इंटरव्यूअर और क्वेश्चन करता है, व्हाट इज द एब्रीविएशन ऑफ फायर? FIRE. ये भी कभी कभी पूछ लेता है, जनरल नॉलेज है. जहां भी आपसे कोई पूछे कि फायर किस चीज से बना है, इसका क्या एब्रीविएशन है, तो F लिखो अपने साथ. F, फाइंड. पहले आपने चेक करना है कि जहां फायर हुआ तो फायर कहां पे है, किस टाइप का फायर है. इज इट ओके? I, इन्वेस्टिगेट. क्या करना है उसके? I से क्या बनेगा? इन्वेस्टिगेट करना है. ठीक हो गया ना, उस फायर के बारे में. और R, जब पता चला कि इन्वेस्टिगेशन हो गई कि इस जगह पे फायर है, तो फिर रेस्क्यू. लोगों को क्या करना है वहाँ से? एज सून एज पॉसिबल बिल्डिंग से लोगों को रेस्क्यू करना है. ठीक हो गया ना. और E, फिर उसके बाद आप लोगों ने क्या करना है? एक्सटिंग्विश. फायर को क्या करना है आप लोगों ने? बुझाना है. तो फायर आज तक आपको किसी ने आई थिंक सो इस तरह पता नहीं होगा आप लोगों को. क्या ख्याल है? फर्स्ट टाइम आपने फायर का एब्रीविएशन सुना है, जो जनरल एब्रीविएशन है. जैसे परसों आपको ABC का पता चला था ना, सेफ्टी डिफिनीशन का, तो आज किस चीज़ का पता चला है? फायर का. क्या मतलब है फायर का अगर कोई पूछ ले? फाइंड, इन्वेस्टिगेट, रेस्क्यू एंड एक्सटिंग्विश. प्लीज कंटिन्यू. हाथ में पकड़.
Fuel, a combustible material or substance consuming during the combustion process. Oxygen, the air oxygen is very rich substance, 21% about oxidizing agent. What is oxidizing agent? It is a substance that helps combustion occur or make a fire. Heat or heat sources. The energy start the combustion process. Now, what is combustion? Chemical process in which oxygen is combined with another substance in the presence of heat.
Good.
Classification of fire.
Very good.
These are classified into materials. Class A, related to solid material, that is wood, paper, cloth, etc. Class B fire, specified by liquid, petrol, diesel, paint, etc. Class C related to gases, gas cylinder, etc. D, related to metal grinding, that is sodium, magnesium, aluminum, etc. E, related to electrical equipments.
Good.
Class F, related to cooking oil and fats.
Good.
And L, related to lithium, ton, power bank, phone fire, etc.
Lithium fire. Also keep in mind, he is explaining ISO 39412 2026 classification. But in all classification there are two, European standard and American standard. So in those two standard there was no E or L over there. Okay? Like in here it is class F. So sometime it is called class F for the kitchen fire, and in American system it is called class K. So mostly E is not considered in class because electricity is not a fuel. It is a source of ignition, like short circuiting occurred and a building caused fire. Now this is ISO standard, so keep in mind this may be varies in the world. It is not confirmed that only these are the classes. You have to check according to your company requirement, your standard or apply over there. Like NFPA is there, OSHA is there, okay, American standard, UK standard is there. So according to the standard you have to classify the classes, because sometime if a student say in NIBOSH class I have learned A, B, C, D, E, F, L, only those classes are there, but now this is changed. I told you it may be the standard requirement, it may be the law requirement, so you have to check what kind of okay classes are utilizing over there. This point is clear to you? Okay.
Heat transformation and its principle. What is heat? Transfer of heat from one place to another place or one object to another. And principal conduction, heat passes through a solid material by direct contact. For example, metal spoon become hot in cup of tea. Convection, transfer heat by movement of liquid or gases. And radiation, heat travels through electromagnetic waves without needing a medium. For example, heat from a sun or fire.
Good.
Zone and classification.
Very good. Important slide, okay? Learn this zone. It is very important.
In hazard environment, equipment must be rated to prevent ignition. The level of protection required depends on the frequency and duration of explosive atmosphere.
Good.
Category 1, it is design of very highest risky area. Zone 0 or Zone 20. These zones have an explosive atmosphere for long period. Category 2, suitable for high risk area. Its name Zone 1 or Zone 21, where an explosive atmosphere is likely occur during the normal operation.
The most dangerous zone is 0 or for the dust particle, combustible dust 20. So the most serious zones are now in industry, Zone 0, 20. Why? This zone have explosive atmosphere for long period continuously. Now category 2 is Zone 1 or Zone 21 for the combustible dust, where explosive atmosphere is likely to occur during normal operation. Now we come to the category 3.
Category 3, intent of low risk area, Zone 2 or Zone 22. Explosive atmosphere is unlikely to occur or will persist for only a short time if it does.
Very good.
Zone numbering.
These mostly Zone 3 can be considered, okay? Zone 2 or Zone 22 can be considered a safe zone, where you can use all kind of mostly equipment over there. But for Zone 1, okay, he is explaining, yes?
Zone 0, 1, 2 refer the haze involving gas, vapor, mist.
Mist,
Mist,
liquid droplets.
mist related to liquid droplets.
Good.
Zone 20, 21, 22 refer to hazard involving combustible dust. Combustible dust related to solid ignition particles.
Good.
Causes of
Okay,
fire.
wait a minute. Where zone, this zone is there, Zone 0 or 20. You have to utilize category 1 equipment. So write down yourself that category 1 equipment is called, okay, intrinsically safe equipment. What is it called? If interviewer asks you in category 1, Zone 0 or Zone 20, what equipment we have to utilize? You will see we will use what kind of equipment? Intrinsically safe equipment. In simple word, it is mean explosion proof equipment. Is it okay? Where it cannot be exploded or causing fire. And it is very, very expensive. In a petroleum industry today, just check in the Google. Okay, this is also your work. What kind of equipment in category 1? What kind of intrinsically equipment, safe equipment are for the petroleum industry? What kind of cameras we have to use? What kind of mobile phone we have to use? What kind of pumps, okay? Pumps, extractor pump, other equipment, electrical equipment. So intrinsically safe equipments you have to utilize in which zone? 0 or 20. Yes, please.
Causes of fire. Many causes of fire such as electrical equipment, deliberate ignition, smoking, cooking appliances, heat appliances, unsafe use and storage of flammable liquid and gas, mechanical heat and chemical reaction. Thank you.
Clapping for them. सही क्लैपिंग करे, इसमें भी आप लोग कंट्रीब्यूट करते हैं. Thank you. अच्छा. Okay, here is another important point. Causes of fire. If I ask you, these are all of causes of fire, can you tell me which is the most serious one? Which is the most common cause in these all? Select one, please. Take from here. Just think.
Reaction or smoking.
Chemical reaction or smoking. What?
Cooking
Cooking appliances. Yes. Cooking appliances. Imagine the site. You are doing site over there. Fire cause. Select one of it. Keep in mind. Heat appliances. Cooking appliances. Yes, Mr. Hasib. Sorry? Please.
Unsafe use of
Storage of flammable liquids and gases. Sir.
Okay, unsafe use of storage of flammable liquid and gases. Yes, please, Ahmad. Yeah? Mechanical heat due to machinery. Yes, please, Nadeem. Electrical equipment. Yes, please. What is your name? Ozef. Yes. Okay, unsafe use in storage. Yes. Your name? Asan. Yes, please. Chemical reaction. Okay.
Unsafe and storage of liquid and gases.
Unsafe. Okay.
Electrical equipment.
Electrical equipment and smoking. You are taking two. You have done it?
Yes, sir.
What you selected?
Like cooking appliances.
Cooking appliances. And what?
Chemical reaction and smoking.
Okay. But after today, this practice, keep remember, no one told me about the main source of the fire, the main reason of fire. This is the main reason, okay? Deliberate ignition. Deliberate ignition is called arson. Write down in the bracket. The mostly when a fire occurred, okay, common causes, and the most common cause is arson. ARSON. What do you mean by arson? Deliberate ignition. Yes. Now I will ask you again another question. Just think about it. Why people started fire deliberately? Think about it, keep in mind, then give me answer. Why people or an organization or sometime, why they deliberately cause fire? What are the reasons? Yes, Mr. Asif.
To cover the facts and to have insurance.
Sorry, for insurance?
Facts and for insurance.
To hide the
Facts, sir.
facts are record, okay, and also sometime for insurance. Only these two. Any other one in your mind? Any other one came in mind? Okay. Write down the most probable reason of a deliberate fire or arson is for revenge, to take revenge. Like nowadays, wheat cropping is there. So you sometimes saw in news that people came at night and burned out all of their wheat stake. Tomorrow is their threshers, and at night their, okay, revengers come and burned out all of the trees.
But the incident.
Yes,
But that-
in the Karachi.
Yes, Waragan.
Yes, this is also revenge. Sometime that is not, that is due to the ransom. You see?
Yeah, ransom,
Yes, they were asking about money. Sometime people are asking, and they burned out completely the organization or car of the people. So most common reason is what? For the revenge. The other one already you told me, that for the hiding of crime, hiding of record. Like आपको याद होगा पुराने ज़माने में भी हाँ बहू जल गई चूल्हा पट गया तो बहू जल गई. So sometime people put fire on the people. They killed that person and they put a fire on it, that it is burned due to the fire. So this is also a main reason, to hide a crime. Is it okay to take revenge, to hide a crime? For insurance purposes, like Agartha Plaza, Rawalpindi fire, some people say it is for insurance. I have a car and I need insurance money or an organization for fire, because fire are insured costs. You remember uninsured insured costs in GIC1? So one of the insured costs was fire. So people cause fire for the taking of money for insurance purposes. So these are the main reason. Sometime conflict with the organization. Like you are in conflict with the organization. So sometime worker put fire on there to give them, okay, loss in the organization. Sometime they don't want to come to the, okay, duty. So they put a fire over there. This is also a reason. Okay, now you understand the reason of arson. Now another important question. How to control arson in organization or in your building? What can we do for arson, to control arson? Can you think about it? To stop arson, what control measure we required? कि कोई बंदा ना आए और आपके ऑर्गेनाइजेशन में फायर ना लगाएं अगर आप वहाँ मौजूद ना हो. अच्छा, इधर एक और रीज़न रह गया आर्सन का. फॉर हैप्पीनेस, सम टाइम वो आग लगाते हैं खुशी के लिए, जैसे कि इराक में हुआ था. शादी हो रही थी तो वहाँ पे उन लोगों ने, जब वो ब्राइड और ग्रूम आ रहे थे, ठीक हो गया ना, उन लोगों ने फायर लगाया. वहाँ जो उसके अंदर जो वो था कैनोपीज थी, वो हाईली फ्लेमेबल थी. آگ لگ گئی اور اس کے اندر 100 سے زیادہ بندے جو ہے نا اس کی ڈیتھ ہو گئی، چونکہ وہ باہر ہی نہیں نکل سکے. یہ کبھی آپ لوگ دیکھو گے تو آپ کو وہ ویڈیو مل جائے گی، لائیو ویڈیو ہے. تو کبھی کبھی جو آرسن ہوتا ہے ڈیلیبریٹ فائر، وہ کس لیے لگاتے ہیں؟ جی میں آج آپ کو اس پہ ایک ویڈیو بھی پلے کر دوں گا. بریڈ فورڈ فٹ بال اسٹیڈیم کا فائر ہے، اگر آپ لوگوں کو آج بھی دکھاؤں گا. تو اس نے خوشی سے لگائی تھی، لیکن اس کے بعد پورا جو اسٹیڈیم تھا وہ 5 منٹ کے اندر بلیز آؤٹ ہو جاتا ہے، کیونکہ وہ جو آگ تھی، آگ کب بڑھے گی؟ دیکھیں آپ کے لیے فائر کے لیے فیوریبل کنڈیشن کیا ہے؟ آکسیجن زیادہ ہو اور فیول زیادہ ہو، صحیح ہے؟ تو جب ہوا ہوگی تو آکسیجن اور زیادہ ہوگی. جیسے آپ آگ ہے نا، آپ اس کو پونکے مارتے ہو، فین لگاتے ہو تو آگ زیادہ ہوتی ہے نہیں ہوتی ہے؟ تو کیوں؟ آپ اس کو فریش آکسیجن دے رہے ہو، فریش ایئر دے رہے ہو. تو جتنا ایئر زیادہ ہوتی جائے گی اتنا ہی جو ہے نا آگ زیادہ ہوگی. کیا خیال ہے؟ آگ لگی ہے اس کمرے میں تو دروازے کھڑکیاں کھول لے نا، ڈورز اور ونڈوز کو. جی ٹو کٹ دا آکسیجن. اب آپ کی ذہن میں پروفیشنل آتی ہے. اس کو آگے میرے خیال میں آپ میں سے کوئی اسٹوڈنٹ رہے گا، کمپارٹمنٹیشن بولتے ہیں کہ آپ اپنی بلڈنگ کے اندر کیا کرو گے؟ کمپارٹمنٹیشن کنٹرول میجر پہ لگاؤ گے. تو ایکسپلینیشن تھوڑی سی کلیئر ہو گئی آپ لوگوں کو چیزوں کی، آرسن کا ریزن پتہ چل گیا. اب بتاؤ نا کنٹرول کیا کریں کہ آگ نہ لگے اس بلڈنگ میں؟ ندیم بھائی کیا انسٹال کریں یہاں پہ؟ جیسے ہم نے انسٹال کیے، کیا انسٹال کیا؟ کیمراز ہو، سیکیورٹی ڈورز ہو، سیکیورٹی پرسن موجود ہو، میگنیٹک لاکس موجود ہو، آپ کا جو ہے نا آٹومیٹک جو ہے نا شٹ ڈاؤن لاکس ہو. خاص کر فائر ایگزٹ کے اوپر بعض اوقات چوری کے راستے سے کوئی بندہ آ سکتا ہے، آگ لگا سکتا ہے. اور مانیٹرنگ ہو. اچھا کبھی بھی اپنی ویریبل ایسٹس کو، جیسے گاڑی آپ لوگوں نے باہر کھڑی کی ہوتی ہے اور آپ کے دشمن آتے ہیں اس کے اوپر پیٹرول اندر ڈال کے ہلکا سا آگ لگا لیتے ہیں، بات ختم. تو یہ بات اپنی ذہن میں بٹھا دو کہ جو سب سے زیادہ کامن جو ریزن ہوگا. اب آپ کو آج کیا پتہ چلا؟ وہاں شو ہو رہا ہوگا کہ یہ اسموکنگ سے فائر لگا ہوا ہے، ڈسٹ بن میں اسموکنگ سے لگا ہوا ہے. لیکن ڈسٹ بن میں وہ اسموکنگ کا ایش ڈالا کس نے تھا؟ کیوں ڈالا تھا؟ اس کا پرپس کیا تھا؟ آگ لگ گئی ہے، جیسے اب پرسوں نوشیرہ والی آگ تھی، میں نے ویڈیو شیئر کی تھی. تو پورا مارکیٹ جو ہے نا 1 گھنٹے کے اندر وہ کیسے پورا مارکیٹ جل گیا؟ اتنا آگ وہ کیسے جلدی پھیل گئی ہے؟ تو آج آپ جب انویسٹیگیشن کرو گے فائر کی نا، تو انشاءاللہ آفٹر دس کلاس اور دس ڈسکشن آپ کو یہ والی جو میری بات ہے یہ یاد آئے گی کہ آپ ایک چھٹی حص میں آپ یہ بھی دیکھیں گے کہ خدا نخواستہ یہ جو آگ ہے جو گھر میں لگی ہے، ٹھیک ہو گیا نا، یہ کسی نے جان بوجھ کے تو نہیں لگائی ہے، ہاں اس کے دشمنوں نے بدلے کے اوپر تو نہیں لگائی ہے، ٹھیک ہو گیا نا، کسی کو سزا دینے کے لیے تو نہیں لگائی ہے، کسی انشورنس پرپس کے لیے ان لوگوں نے خود تو نہیں لگائی ہے کمپنی کے اندر. تو یہ جو انویسٹیگیٹو آپ کا مائنڈ جو آج آپ کا ہوگا نا، اس سے آپ لوگ پھر فیکٹ نکالو گے. اس لیے کہ حادثات میں سے فیکٹ نکالنا بہت زیادہ امپورٹنٹ ہوتا ہے. کیا خیال ہے؟ تو میرے خیال میں صبح سے کنٹینیوس کلاس ہے، تھوڑا سا بریک لیتے ہیں، ٹھیک ہے؟ نیکسٹ سیشن اس کے بعد پھر جو ہے نا کنٹینیو کرے گی. کیسا رہا سیشن آپ لوگوں کا؟ کلیپنگ کرے سب کے لیے، سمیت سے سمیت. گڈ، ویری گڈ، تھینک یو.